Chapter 4: Theoretical Foundations of Nursing Practice. Nursing Foundation. Theory is the foundation for the art and science of nursing. Theory-based nursing practice helps you to design and implement nursing interventions that address individual and family responses to health problems. Theories offer well-grounded rationales for how and why nurses perform specific interventions and for predicting patient behaviors and outcomes. Expertise in nursing is a result of knowledge and clinical experience. Nursing knowledge improves nursing practice by connecting theory and research. Nurses develop theories to explain the relationship among variables by testing the theory through research and applying it in practice. Theory, research, and practice are bound together in a continuous interactive relationship. Throughout this process, new information often comes to light that indicates the need to revise a theory, and the cycle repeats. Theory. Nursing is both a science and an art. The science of nursing is based on data obtained from current research. The art of nursing stems from a nurse's experience and the unique caring relationship that a nurse develops with a patient. Nursing theories help to explain an event by defining ideas or concepts, explaining relationships among the concept, and predicting outcomes. Nursing theory is a conceptualization of some aspect of nursing. It describes, explains, predicts, and/or prescribes nursing care. A nursing theory helps to identify the focus, means, and goals of practice. Nursing theories also enhance communication and accountability for patient care. Components of a theory. A theory contains a set of concepts, definitions, and assumptions or propositions that explain a phenomenon. It explains how these elements are uniquely related in the phenomenon. Nursing theories focus on the phenomena of nursing and nursing care. A phenomenon is the term, description, or label given to describe an idea or responses about an event, a situation, a process, a group of events, or a group of situations. A theory also consists of interrelated concepts that help describe or label phenomena. Concepts are the words or phrases that identify, define, and establish structure and boundaries for ideas generated about a particular phenomenon. Theorists use definitions to communicate the general meaning of the concepts of a theory. Definitions may be theoretical or operational. Theoretical or conceptual definitions simply define a particular concept. Operational definitions state how concepts are measured. Assumptions are the taken for granted statements that explain the nature of the concepts, definitions, purpose, relationships, and structure of a theory. Assumptions are accepted as truths and are based on values and beliefs. The domain of nursing. The domain is the perspective or territory of a profession or discipline. The domain of nursing gives nurses a comprehensive perspective that allows you to identify and treat patients' healthcare needs in all healthcare settings. A paradigm is a pattern of beliefs used to describe the domain of a discipline. It links the concepts, theories, beliefs, values, and assumptions accepted and applied by the discipline. Often used synonymously with paradigm is the term conceptual framework. A conceptual framework provides a way to organize major concepts and visualize the relationship among phenomena. Different frameworks provide alternative ways to view the subject matter of a discipline and represent the perspective of the author. The nursing meta-paradigm allows nurses to understand and explain what nursing is, what nursing does, and why nurses do what they do. The four meta-paradigm concepts include person, or human beings, health, the environment or situation, and nursing. Person is the recipient of nursing care, including individual patients, groups, cultures, families, and communities. Your challenge as a nurse is to provide the best possible care based on a patient's level of health and healthcare needs at the time of care delivery. Health has different meanings for each patient, the clinical setting, and the healthcare profession. It is a state of being that people define in relation to their own values, personality, and lifestyle. It is dynamic and continuously changing. The environment, or situation, includes all possible conditions affecting patients and the setting such as where they go for their health care needs. According to the American Nurses Association, nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. Thus, the scope of nursing is very broad. Evolution of nursing theory. Florence Nightingale is generally regarded as the first nursing theorist. Her theory was founded on her belief that nursing could improve a patient's environment to facilitate recovery and prevent complications. With the 20th century approaching, nursing began to transition from a vocation to a profession, which prompted American nurses to standardize nursing education and diploma programs and encouraged more nurses to seek academic degrees. The curriculum era of nursing spanned the 1900s to the 1940s. During this period, nursing education expanded beyond basic anatomy and physiology courses to include courses in the social sciences, pharmacology, and nursing arts that address nursing actions, skills, and procedures. The research era encompassed the 1950s, 1960s, and 1970s, during which nurses became increasingly involved in conducting studies and sharing their findings. At this same time, the graduate education era began, and early versions of nursing theories were developed that offered more structure to nursing research. The renowned theorists of this time period included Johnson, King, Levine, Newman, Oram, Rogers, and Roy. The theory era, which included the 1980s and 1990s, significantly contributed to knowledge development. During this time, the nursing meta-paradigm was proposed by Fawcett. This era resulted in the publication of several nursing journals, the development of nursing conferences, and the offering of more doctoral programs in nursing. The 21st century is considered the era of theory utilization. Today, nurses strive to provide evidence-based practice, or EBP, which stems from theory, research, and experience. The focus of EBP is safe, comprehensive, individualized, quality healthcare. The original grand theory served as springboards for the development of the more modern middle-range theories, which, through testing in research studies, provided evidence for EBP and promoted the translation of research into practice. Theory use today is congruent with current national goals for quality healthcare. Please review Table 4.1, Historical Eras of Knowledge Development in Nursing, as a supplement to this PowerPoint. Types of theories. A grand theory does not provide guidelines for specific nursing interventions, but provides the structural framework for broad and abstract ideas related to nursing. Middle-range theories address a specific phenomenon and reflect practices of administration, clinical interventions, or teaching. A middle-range theory tends to focus on a concept found in a specific field of nursing, such as uncertainty, incontinence, social support, quality of life, and caring, rather than reflect on a wide variety of nursing care situations, as the grand theories do. Practice theories, also known as situation-specific theories, bring theory to the bedside. Narrow in scope and focus, these theories guide the nursing care of a specific patient population at a specific time. Descriptive theories do not direct specific nursing activities or attempt to produce change, but rather help to explain patient assessments. Nurses use prescriptive theories to anticipate the outcomes of nursing interventions. Please review Box 4.1, Goals of Theoretical Nursing Models, as a supplement to this PowerPoint. Theories have different purposes and are sometimes classified by levels of abstraction, grand versus middle range versus practice theories, or the goals of the theory, descriptive or prescriptive, shown as Figure 4.3, correlation of theory category, with level of abstraction. Theory-based nursing practice. Theory generates nursing knowledge for use in practice, thus supporting evidence-based practice or EBP. Nursing knowledge is derived from basic and nursing science, experience, aesthetics, nurses' attitudes, and standards of practice. Nurses use theory to provide direction in how to use the nursing process. For example, the theory of caring influences what nurses need to assess, how to determine patient needs, how to plan care, how to select individualized nursing interventions, and how to evaluate patient outcomes. The integration of theory into practice leads to coordinated care delivery and therefore serves as the basis for nursing. The goal of nursing knowledge is to explain the practice of nursing as different and distinct from the practice of medicine, psychology, and other healthcare disciplines. Shared theories help explain a phenomenon specific to the discipline that developed the theory. It is also known as a borrowed or interdisciplinary theory. To practice in today's healthcare systems, nurses need a strong scientific knowledge base from nursing and other disciplines such as the biomedical, sociological, and behavioral sciences. Several nursing theories are based on systems theory, and the nursing process is also a system. Like all systems, the nursing process has a specific purpose or goal. As a system, the nursing process has the following components: input, output, feedback, and content. Input for the nursing process is the data or information that comes from a patient's assessment. Output is the end product of a system, and in the case of the nursing process, it is whether the patient's health status improves, declines, or remains stable as a result of nursing care. Feedback serves to inform a system about how it functions. For example, in the nursing process, the outcomes reflect the patient's responses to nursing interventions. The outcomes are part of the feedback system to refine the plan of care. Other forms of feedback in the nursing process include responses from family members and consultation from other healthcare professionals. The content is the product and information obtained from the system. For example, patients with impaired bed mobility have common skin care needs and interventions that are very successful in reducing the risk for pressure ulcers. Please review Table 4.2, Overview of Select Shared Theories, as a supplement to this PowerPoint. Time for a quick quiz. Nursing theories provide nurses with perspectives from which to A. Analyze patient data, B. Predict phenomena, C. Formulate legislation, or D. Link science to nursing. The answer is A. Analyze data. Case study. Susan is a new nurse who tutors a nursing student, Bill, who has difficulty mastering good study habits and prioritizing school assignments. Susan is helping Bill learn the theoretical foundations of nursing practice. After Susan and Bill review interdisciplinary theories, such as Maslow's hierarchy of needs and the developmental theories, they move on to the topic of nursing theories. Susan knows that it is important for Bill to develop a study technique that assists in helping him remember interdisciplinary theories. Select nursing theories. Florence Nightingale is credited with developing the first nursing theory. The focus of Nightingale's grand theory is a patient's environment, which Nightingale believed nurses should manipulate, such as ventilation, light, decreased noise, hygiene, nutrition, so nature is able to restore a patient to health. Through observation and data collection, she linked the patient's health status with environmental factors and initiated improved hygiene and sanitary conditions during the Crimean War. Hildegard Peplow is considered to be the mother of psychiatric nursing. The focus of her middle-range theory includes interpersonal relations among a nurse, a patient, and a patient's family, and developing the nurse-patient relationship. According to Peplow, nurses help patients reduce anxiety by converting it into constructive actions. The phases of the nurse-patient interpersonal relationship include pre-orientation, data gathering, orientation, defining issue, working phase, therapeutic activity, and resolution, termination of relationship. In developing a nurse-patient relationship, the nurse serves as a resource person, counselor, and surrogate. As the nurse-patient relationship develops, the nurse and patient mutually define the problems and potential solutions. When the patient's original needs are resolved, new needs sometimes emerge. This middle-range theory is useful in establishing effective nurse-patient communication when obtaining a nursing history, providing patient education, or counseling patients and their families. Please review Table 4.3, Overview of Select Grand and Middle Range Nursing Theories, as a supplement to the PowerPoint. Dorothea Orum's theory is commonly used in nursing practice. When applying this grand theory, a nurse continually assesses a patient's ability to perform self-care and intervenes as needed to ensure that the patient meets physical, psychological, sociological, and developmental needs. According to Orum, people who participate in self-care activities are more likely to improve their health outcomes. Nursing care becomes necessary when patients are unable to fulfill biological, psychological, developmental, or social needs. Nurses continually assess and determine why patients are unable to meet these needs, identify goals to help them, intervene to help them perform self-care, and evaluate how much self-care they are able to perform. Madeleine Leininger recognized the need to focus on culture in nursing, as she predicted that nursing and health care would become more global. She blended her background in anthropology with nursing to form her middle-range theory of cultural care diversity and universality. Human caring varies among cultures in its expressions, processes, and patterns. Social structure factors, such as a patient's politics, culture, and traditions, are significant forces affecting care and influencing the patient's health and illness patterns. The major concept of Leininger's theory is cultural diversity, and the goal of nursing care is to provide a patient with culturally specific nursing care. To provide care to patients of unique cultures, nurses safely integrate their cultural traditions, values, and beliefs into a plan of care. Leininger's theory recognizes the importance of culture and its influence on everything that involves a patient, including health beliefs, the role of family and community, and dietary practices. Case study. Bill reads about the concept of culturally specific nursing care. The theory that integrates patients' cultural traditions, values and beliefs into care plans is what? The answer is Leininger's theory. The major concept of Leininger's theory is cultural diversity, and the goal of nursing care is to provide a patient with culturally specific nursing care. To provide care to patients of unique cultures, nurses safely integrate their cultural traditions, values, and beliefs into a plan of care. Leininger's theory recognizes the importance of culture and its influence on everything that involves a patient, including health beliefs, the role of family and community, and dietary practices. The link between nursing theory and knowledge development. Nursing knowledge is theoretical and experiential. The goals of theoretical knowledge are to stimulate thinking and create a broad understanding of nursing science and practice. Experiential knowledge, or the art of nursing, is based on nurses' experiences in providing care to patients. Nursing theories guide nursing practice. When using theory-based nursing practice, you apply the principles of the theory in delivering nursing interventions in your practice. Grand theories help shape and define your practice. Middle-range theories continue to advance nursing knowledge through nursing research. And practice theories help you provide specific care for individuals and groups of diverse populations and situations. Time for a quick quiz. Nursing process is central to nursing practice. Nursing practice, A, is a theory, B, is derived from a theory, C, is not adaptable to all patients, or D, generates knowledge for use in practice. The answer is B, derived from a theory. Case studied continued. Susan quizzes Bill about the core concept of Peplow's theory. Peplow's theory has only 3 phases, including orientation, working, and resolution. Is this true or false? The answer is false. Peplow's phases of the nurse-patient interpersonal relationship include pre-orientation, or data gathering, orientation, or defining issue, working phase, or therapeutic activity, and resolution, or termination of relationship. The relationship between nursing theory and nursing research. Research validates, refutes, supports, and/or modifies theory, and theory stimulates nurse scientists to explore significant issues in nursing practice, leading to the improvement of nursing care. The relationship between nursing theory and nursing research builds the scientific knowledge base of nursing, which is then applied to practice. Nurses better understand the appropriate use of a theory to improve patient care as more research is conducted. The relationships between the components of a theory often help identify research questions and determine the overall design of a study. Sometimes research is used to develop new theories. Theory-generating research tries to discover and describe relationships of phenomena without imposing preconceived notions of what the phenomena under study mean. In theory-generating research, the investigator makes observations to view a phenomenon in a new way. Theory testing research determines how accurately a theory describes the nursing phenomenon. Testing helps to develop evidence for describing or predicting patient outcomes. Theory provides a basis for research and practice and serves as a guide in providing safe, comprehensive, individualized care, which is the hallmark of nursing. Please review Box 4.2, Evidence-Based Practice, Theory-Based Practice in the Management of Patients with Cancer, as a supplement to this PowerPoint.